Okay, we're ready to make our alginate tongue. So I've already pre-dosed my powder, 1 level scoop of alginate. I'm using the 1 scoop level of water, and that goes in our bowl. Just gonna mix this up real quickly. If you forget this step, it will make it very difficult for you to trim in a nice set of study models. So this will save you ultimately a lot of time later. You just mix it up good like you normally mix an impression. Gather all your alginate up in one area. Take the Kleenex. I just fold it in several times to get this size. You're going to take your alginate, again nice and thick, right on top of the tissue. You're going to take it from the underside of the impression, push up, and then get a wet finger and smooth it out so that it is the same level and not above the lingual vestibule. It should be nice and smooth, and again, level with the lingual vestibule. You'll need to allow that to set up a couple minutes, and then we'll be ready to pour. Okay, now to pour this lower impression, we're going to use one of the lovely ceramic tiles that you have over in clinic. First thing you're going to do is take a piece of paper towel, just a regular hand towel out of the towel dispensers. You're going to get it wet. Just rinse off the excess and lay it really nice and smooth on the tile, and this will allow you to remove your impression and your model very easily. Okay, we're going to be using the same amount of material. We're still going to use about 250 grams of powder, and we're going to use approximately 115 cc's of water. There again, depending on the how accurate your measurement is with your scale. And we're going to put our water in our bowl, the large bowl. And then we're going to slowly add our plaster, making sure all the powder is completely wetted. And again, you want a kind of a nice creamy mix, no water. It should not run out of your bowl. Make sure that you scrape the sides, get all the plaster really wetted. Scrape off the spatula so you don't have any dry powder on there, and continue to mix. Then we'll do the same thing that we did for the maxillary. Vibrate it slightly on the model, on the vibrator, getting some of the air bubbles up to the top. And there again, hold your impression with your non-dominant hand and slowly vibrate your plaster right into the impression. If you add it too fast, you'll trap some air bubbles. If you add it too slow, your plaster might just set up in the bowl before you get it in the impression. Watch it flow. Now to fill this end over here, I am going to add some plaster right there. Make sure it gets in the right formaldehyde fossa area. Same thing on the other side. And now that I have the teeth filled, I am going to build up a little bit more plaster on the top. Spread it out nice and neat. And just hit it just slightly on the vibrator. Okay. Set that aside. And now I'm going to take the rest of the plaster. And what we're going to do with this is we are going to put it on a piece of paper towel first to get out some of the excess moisture. Again, leave some in your bowl. Clean your edge of your spatula. We're going to kind of fold it up like so. And roll it around in your hands, pat off the excess moisture. Then you can actually have it in your hands, and now you can form a nice little round patty on the ceramic tile, and the plaster won't flow all over the place. Now we're going to invert the impression again. And you're going to, again, gently jiggle it down to form your nice patty. Hold the handle. Now some of this is a little excess, so we can take that. Put that back in the bowl. And what I'm doing again is ensuring that the occlusal plane is totally level. Don't want it crooked. Now notice on the mandibular, since we have the tongue, we don't have to worry about clearing out that area. But what you do want to do is sometimes add a little extra to build up the heels on the mandibular. Again, going around the side. Again, do not bury, because you will be sorry later. Take your spatula, get a nice flat, level land area here. So it's nice and smooth. And now when it gets almost to initial set, we can actually take the spatula and actually cut right through and reduce that width, and it comes out real nice and clean. And then you won't have so much to trim later on. Now this is a technique that you're going to be using when you're pouring your case study models, whether it be maxillary or mandibular. So the more time you take with this, the better off your case study model will be. And it'll be trimmed up real fast. And there we have it.